Hi everyone, welcome to Szenan-Balance Live. I'm Szenan-Balance from Szenan-Balance, the acupuncturist. Now today is day 6 of New Zealand lockdown time. I hope everyone doing well. In this period, we have 3 more weeks to go, and we may need more lockdown time. But anyway, I'm here to show you a topic of acupressure point for lower back pain or stiffness in your back. Okay, and it's just a simple point for you. Okay, so if you're an acupuncturist, now you know when I show you this acupuncture go model, you know where the meridian is. But if you're a patient, you're not an acupuncturist, you don't know anything about meridian, that's okay. Don't get panicked, because what I'm going to show you, all the point, is going to help with your back pain anyway. Okay, you don't need to know about where the meridian is, but you do need to know where this acupressure point is for lower back pain, not for upper back pain. Okay, not for your headaches. All right. So lower back pain is about here. So if your belly button, so go to belly button, go over here. That's your lower back. So along here, as you see all the red line, if an acupuncturist, you know, oh, this is 2 meridian, bladder meridian. Then over here on the side is gallbladder meridian. But you don't need to know the meridian at all. But this point gonna help you. Okay, now you may have some pain go toward over here in your bottom on the sacrum area. Sacrum area means your tailbone area, all right, or above the tailbone. Okay, and this method, this point gonna help with this as well. Okay, now if you have pain go down to your lower leg with sciatic pain, the pain in your lower back or in your buttocks, it will lay to your sciatic nerve. Hey, this may not help with the sciatic nerve, okay, and therefore you probably need to book an appointment, or we now have online consultations that we can ask you further question and to make sure where is the pain and show you some acupressure point that you can work on while this lockdown time. Now, unfortunately, we can't get you come into a clinic to give you acupuncture at the moment, or we can't set up any herb because the shipping is not for Chinese medicine at the moment. We are trying our best to get the courier to send out our herbs for us, but we haven't heard anything from our association yet. So anyway, so any pain in here. So first thing you need to do is try to stand up and then bend forward or backwards or side by side, or even just look back, you know, all this movement. Why do I need to do this? Because when a patient comes in for back pain, I always ask them to do this movement to test out whether which movement give them any pain. Okay, if any movement you bend down, you get pain worse on bending, then you're gonna press all this point. While you press all this point, and you're gonna do the movement, or after this point you're gonna do the movement. All right, so let me show you the technique. If you watch my last video for the neck pain, then you know the technique already. The technique is so simple. Only use your index fingers. Okay, so index finger over here. So this is index finger. If you have back pain right now, hey, come, just follow me. I'll show you how to get rid of or to reduce your back pain. Now, if you are on Facebook, please share this video, this live video, to your friends who need who suffer from back pain and who need help from acupressure point. Okay, now if your family have it, just send it to them or tag them into this video. Okay, if you're YouTube, Yes, you can watch this and then take this link and send it to your friends as well. So index fingers, give your index fingers, then bend your index finger down and use your thumb to support it. Okay, you're gonna use this part, okay, to press and rub. All right, this is one thing. Second, you can use your thumb. So make a fist. Your thumb, bend your thumb, and your tip of your thumb, and press it on your index fingers over here. All right, just like this. So you use here to as a device, okay? Or you can use a chopstick. Chopstick, yeah, to the round bit, not the sharp one, okay? Or you can get a massage device. It need to be small, okay? Then where is the point? Now we show you those points yesterday for your neck pain, right? Today I'm going to show you a point that started from here, right? So this point is in the end of the metacarpal bone. This is called metacarpal bone. Okay, fingers go down here on your palm over here on the back. You can feel bony over here. This is called metacarpal bone. And between the first and the second, which is your thumb and your index fingers, which is first and second metacarpal bone in the joint over here, right? So those two metacarpal bone, it come to here, joint together. If you move over here, you can find it. It actually in the joint over here, okay? Not on the bone, between the bone, okay? This is in the corner, right? So what you're gonna do, use your knuckle and press it over here. Press it, okay. I'm gonna use my thumb. You can use an index fingers, up to you, okay? Because showing you in this way is easier. So press it over here, all right? So press and rub, press and rub. So you feel that it's quite sensitive here. If you get to the sensitive point, that is right. So how long do you need to press on? If you can't find it, you can go along, go up a little bit, or go down a little bit, go further to the bone a little bit, and you press it and press it toward to the bone. You feel more sensitive. Okay, I'm hoping that you're following me, that you get it. If you can't get it, you want me to repeat, please type it and let me know. All right, so press this. And how long do you need to press it for? So about 30 seconds to 1 minute each point. Okay, when you get to 30 seconds, so let's press it together, then move to the next point. And the next point is just on the same level, right, between index fingers and the between the second metacarpal bone and the third metacarpal bone. All right, so this is another point over here. So again, use your knuckle and press it. Okay, I want to mention that when you press it, use your thumb like this. Don't do it on the horizontal. Don't do it on that way and push it that way, because you're gonna press it on the bone, not on the point. Okay, turn this, then you'll be able to press on the point. Okay, so if you're an acupuncturist, you can just simply put a needle in here and a needle in here. Right? There is no if you see that there is a vein in there, just press it aside of the vein so you don't hurt the vein. Right? So press it and rub it again for 30 seconds. For 30 seconds. All right. That's it. So and then keep going to the next point over here. So over here is the third with the middle finger, the third metacarpal bone, and the fourth metacarpal bone, and between them. And again, when you press on the bone and you go, oh, it's at between them. Okay, in the end of the bone. So and press it like this. If you can't find the sensitive point, you can move up a little bit and make it another point over here. All right, so get to the most sensitive point. It'll help you even better. Okay, so press it for 30 seconds or 1 minute. Then the fourth point, is between the ring finger and the little finger. Go ahead and extend to the metacarpal bone, which is the fourth and the fifth metacarpal bone, between them. All right. So again, use the same technique and press it and rub it. That's it. So simple. So simple. Just press it around for up to 30 seconds or 1 minute. Then what happened the next is go to the fifth metatarsal bone on the side of the fifth metatarsal bone. So you can see that there's a black and white line over here, on the line over here, closer to the fifth metacarpal bone. So you can move up a little bit, lower a little bit. Okay, this is a bit difficult, so you may not get to the point, but just press it and rub it and get to the most sensitive one. I'm actually trying to figure it out which point is the most sensitive one. Okay, this one is the most sensitive. Okay, and press it like this. Okay, just like this. Just like this. Okay, so that's it. So this point, this 5 point, we call it 5 back point. 5 back points is on a local balance, what we call local balance. Why do we call local balance? Because they are very good to treat local back pain. All right, very good to treat local back pain. Now, while you press those points, the first time you press it, then you can stand up. Now you can stand and try to work it out, movement, and see whether it gives you any relief or not. If it is, keep going. Give it for another 2 or 3 times. Okay. Or while you press it, like while I'm pressing that one, I can move, do some movement on my back. All right, on the lower back. Okay, and that will help it even further. All right. Now, if it helps, do it every day, once a day. Right, just at least once a day. You need to press all this point. So, and whenever you get pain in the lower back or stiffness or tightness, you do it another time. Do extra. Okay, do extra. Then your aim is to get it once a day for weeks, for the next couple of weeks or next couple of months, to get rid of all the sensitive points. If your organ functions, if your internal organ function are still strong, then by doing those, you may already feel that it's good enough for your lower back pain. It will just heal beautifully. But in some cases, well, in what cases it doesn't help, which means if your organs function are not as good, you know, we call the energy in the organ is low, then when you do those points, it may not work very well for you, or it may work very well, but it doesn't last so long. Okay, or while you do it, you feel good. As soon as you stop it, the pain came back again. So, or when you do this point, it helped you for the next few days, but it can't go any further. Then that means that in a very high chance that you have imbalance in your organs. So what you're gonna do next is you probably need to call us. Okay, so we are closed right now, as you can see on the Facebook below, and Facebook on the top and YouTube below. You can see our email address. You can send an email and to request a consultation for acupressure appointment. So it's up to 30 seconds. We can do one-on-one on video internet, then do a consultation to suggest you other point that to help with organs recover. Therefore, you may see that the acupressure point over here will work even better. Or we can wait until we reopen and you come in, and we'll do a full consultation to understand what's going on to your organs, or we'll give you a care plan, whether it's Chinese herbs, acupuncture, or acupressure point all together. All right.
There are a lot of things that you can do. Another best thing for lower back pain, especially for chronic lower back pain, is put a heat pack on your lower back, right? Put a heat pack on your lower back, and that'll help a lot. Okay, if that helps, do it more often. Okay, you don't need to do a very hot heat pack, just gentle one. Right? I'll see you tomorrow, and stay awesome. And I love you all. And see you tomorrow. Bye bye.